an orthopedic surgeon all the way from AICQ International. How are you, Daktari?
I'm fine, well.
Yes.
Thank you.
Great to have you with us tonight. How are our friends back there at AICQ?
Wako vyema. Nashukuru Mungu.
Wako vyema.
Kabisa.
We thank God for you as well. And so for the past many months, we've been learning a lot about the health of our bones, and it's always great to know more in such sessions that we have here. So tonight we have this condition, or is it a disease? I was trying to pronounce it, but I think I'm failing in some way or the other. Is it Sever's disease or Sever's disease? You know, Bo, you can let us know about that. The pronunciation, then we'll get to know what it is all about.
Yeah, it's called Sever's disease.
Sever's disease.
Sever.
Yes. So what is it all about?
Sever's disease is the medical called calcaneal apophysitis. First, the name Sever was actually an American doctor who discovered it in 1912. It's called James Warren Sever, hence the term Sever's disease. So I'll talk about apophysis. Apophysis is a location in the area of the body when someone is growing. There's a part that has a growth plate, the parts where children grow through. That they fuse when someone becomes an late adolescent, now transitioning to an adult. And that part is attached by a tendon. A tendon is what helps you move. Like when you have, like you think about the kneecap, attaching it to the shin bone is a tendon. And so that part is where it's called a tendon. That's what actually helps you move your joints up and down and be able to move and from one point to another. And so for calcaneal, this is the heel bone. That's where we use, especially in terms of walking, jumping, running. And so calcaneal apophysitis is called inflammation, is where that part swells and gets pain due to repetitive trauma. This mainly happens because now we are going into where children are more involved in sports, competitively, also non-competitively. And so the age is between actually 8 to 14 years at this point where children are very active. And that point is a point of rapid growth spurt. And so when there's a rapid growth, the tendon or the muscle does not grow at a faster rate, and so it's prone to injury. It mainly happens in children who play basketball, soccer. It can also, apophysis can occur actually in many places. This is just one of the areas. It can be in the shoulder, it can be in the hip, it can be in the knee itself, it can be also elbow. And so this is what apophysitis is, where there's inflammation at that point, where there's attachment of that tendon, and it causes pain due to overuse injury. And so about apophysitis, so this is heel pain that occurs especially in immature athletes. That's between 8 to 14 years. So the growth plate at that point, for girls it fuses around 15 years, for boys it's later about 17 years. So in this period of when the bone is beginning to come together, that's when this apophysitis happens. And so one thing about it is, so mainly occurs, I've talked about the age group. Then the thing that happens is at this age, what happens is the bone, like what causes now apophysitis is, we've talked about the overuse or repetitive trauma because of the walking, running, jumping sports. And so what happens is in attaching to the bone itself is the independent growth plate that's beginning to close. And then what happens is where the attachment is, that point, it's a point of weakness. And so it's pulled fast higher by the tendon itself. And that traction is what causes the pain. It mainly presents, not that there's injury that happens, but it's because of the repetitive use that causes pain. And so one thing that happens is a child might be okay, or an adolescent, they wake up okay. Then at the end of the day, because of the constant running, high competitive sports, at the end of the day, they might feel a bit of pain. At that point, it may initially become just pain that goes on and off. But with time, if it's not really noticed, with time they have even pain that it's difficult to actually play sports or just do the normal activity in terms of walking or throwing sports. That's what happens. But specifically for calcaneal apophysitis is pain on walking or running or the jumping sport that they do. And so what we now do in the Bible is the history that we take. Then in terms of physical exam, what we actually check, we check also the how the child is walking in terms of the gait. We assess if there's any pain, or does the child have any limping? Is there any swelling along that area of the heel? How is the calf muscles itself? Because probably they're having constant pain, and so they're not using the calf as much. And so we also assess at that point. We check the knees themselves if there's any problem. Then after that, what we actually do is imaging. There's imaging that we recommend. Probably they might have pain on one side of the heel or both heels. So it's advisable when you're doing, when the doctor is ordering the x-ray, or the health professional who's available, to do x-rays of both feet so that you're able to see if there's any change. For people initially, when they look at it, they might think that it's a fracture, but actually it's not a fracture itself. It's actually that growth plate that's delineating it. And so, yes, that's what we do in terms of seeing, examining. Then we go to management. First, it's good to reiterate that it's a self-limiting disease. It's not something that if you miss it, that it will cause any problems in future. Actually, it reduces when the growth plate at that point closes, those symptoms tend to go away. And so where it comes is, if a child is competitive, what is the advice? Or even if a child is not competitive, they're active, they're having pain, what do we do? So management, first, it's mainly non-operative or conservative. So we actually advise on rest from active sports. We recommend ice, putting ice at that point, because sometimes it can be swollen, can be hot, painful because of that traction injury. Then also like compression or massage, either at the calf or at the heel region. Then after that, what we actually recommend after rest, we recommend either custom-made orthosis or an over-the-counter heel orthosis. Orthosis is something that helps just maintain the position of a foot or any form of a joint. And so the purpose of this, it's maybe silicone, can be some bit of some small rubber sole that is actually custom made for the child, that puts inside the shoe so that it's easier to walk. Then after that, what we do is stretching exercise before we strengthen. So there's a stretching exercise. So the example is one. First, after that, a phase of rest, ice, and massage. The other thing is actually stretching exercises. So the purpose of this is just to help the muscle so that it relieves that tenseness, because it's contracted it's really contracted, and so it is just to stretch so that we now go to strengthening of the muscle itself. So there's one that is used as a foam roller. It's a foam roller that's applied at the back of the heel, or rather back of the calf muscle, just to help relax the calf itself. We don't put it at the heel because sometimes it can cause a lot of pain.
Okay.
Then after that, there's also what we do is where a child, you sit on the floor and you take a towel and take it underneath the foot itself, on the part of the foot, and you gradually stretch and you just hold 1 up to 10, and then you increase gradually. If any improvement, so what happens is now we go from towel, now we go to weight bearing stretching exercise. So the purpose of weight bearing stretching exercise now, because you've advanced, because you're able to stretch further and there is minimal pain. Weight bearing is where the child stands on the wall and with one heel on towards the wall and the one that's affected towards the back, you stretch with the leg straight without bending the knee. So what happens is with that, we are actually able to help stretch the calf muscle. We're able to stretch the heel muscle. We're able actually to stretch also the foot or the plantar fascia below. So that helps actually in terms of stretching it. We give a period of, you count actually about 1 to 10 and you gradually increase. You can decide to do 1 set or 2 sets or 3 sets, just depending on how comfortable you are. Initially, it's guided by the rehab team, and actually they're able to guide you on how to do it even at home. Then once you're now comfortable with that, there's what is called a TheraBand or a resistance band. That's now something that you put on the flat part, because now we have advanced from towel to weight, and now you use a resistant band, and where you try to push against the force, where you're holding the resistant band on the flat part and you're pushing it. So you're trying to strengthen that muscle itself, but by against resistance. So you can either do it 1 day or 2 times a day. You can count 1 to 15, like you're taking it fast. They're pushing the band is pushing. You're pulling it against resistance to the foot going to your shin. Then you push forward like you're pressing a pedal.
Okay.
So you count 1. Hope you're able to visualize that.
Yeah, I'm visualizing because I'm hearing you talk
Yes.
about how you can actually manage that child with that particular disease while at home.
Yes. Then the other thing, so painkillers actually, it's not painkillers actually good, but it should only be for a short course of time, because when you combine that with rest, it helps go that acute phase of pain, and then you now gradually exercises once the acute part or the part that's having a lot of pain that causes difficulty in activity happens. Yes, so that's actually essentially how the apophysitis or Sever's disease happens. What we do.
And as you were sharing with me regarding this, I realized that it mostly affects children, as you've said, between the ages of 8 to 14.
Yes.
And then mostly those who are involved with sports.
Yes.
So what about those who are not active? Can they also get these even by just having their normal walks and all that?
Yes, it can actually also happen, because at that point also they are having rapid growth. And so at that point it's where it's the growth plate is actually weak. And so that muscle tends to pull it with even the normal walking. And so it can also happen in children who are not playing competitive sports. Yes, thank you for that question.
Yeah. And also in the same line, as you've talked about sports, and I know children in their formative ages would like to involve themselves with activities of now having been diagnosed with Sever's disease. Can they continue engaging themselves in sports, or should they refrain for a period of time before they can recover?
And so that is actually dependent first on the psyche of the child and the willpower that they have, because some children may say, I want to play this sport. And one thing is, first, it's self-limiting. It takes between 2 weeks to about 2 months for it to recover. And so they can actually play competitive sports. They can actually do the activities what we talk about is just giving it a period of rest, and you now start gradual physio exercises just help stretch that muscle or that area to just help with recovery. Yes, and one thing also, it can still happen despite you finish the full phase of physio, you've recovered, you're back to sports. As long as you're growing, there's that risk. So it actually stops being a risk once that growth plate has fused. Yes.
A parent may be concerned about this disease. Can it affect the child's growth, and does it have any long-term effects on this child?
Thank you for that. So as long as it's not a fracture, if it's a fracture that happens, that we can injure that growth plate, that's what can limit. But if it's just the pulling aspect, it does not have any long-term effects. Yes, so it doesn't first also stop growth. Yes.
All right. And if you would now take us through the clinical, because you've also talked about a bit of what the management of the disease would be at home. You could also remind us of what you do at the clinic or at the hospital when such a case is presented to you.
So when the child comes to the hospital, it comes accompanied with a parent.
Yes.
So we see them in the clinic, and we get a history just from mainly the parent or the adolescent or the child, because they're older, they can express themselves. They talk. What we get to know is where is the pain, how frequent is the pain? Is it mainly in the evening? Is it after play? Is it in the morning? So for pain associated with the Sever's disease, it mainly happens around in the evening when they're not relaxing because they were very active. So in the evening, they're beginning to have pain. They might have limping because of pain as they're walking. And then when they rest, they do not have any pain. Then we get to know whether they've taken any painkillers that they are not able to bear with the pain. The other thing also we get to know first also is any other injuries. Was there any recent injury? Because not only can they heal pain because Sever's disease, could be other things. It could be either a bit of a fracture because of stress fractures that can happen on the foot. Can be swelling around the heel itself, which the back of the heel. Yes, so then after that, once we get the history, we actually now do a clinical exam, and we actually see how the child is walking without shoes and without the socks. So we are able to see, because the other thing also I like to add also, we check how is their arch, how their arch is because if there's any change in the arch, with children with flat foot, they might have, they may be prone to getting that traction injury because the biomechanics is altered, or they have a high arch. Then we actually see how they walk. That's one. If there's any limping or is there any problem. Then we actually also just examine the child generally and see if there's any other features around the body. Then we check if there's any problem moving of the joints, whether the knee, whether the foot itself, the toes. And also after looking, feeling and moving, we also get to actually compress. Also what happens is with the child lying on the tummy and putting the end of the foot on the bed, we actually squeeze the calf itself. If it stretches or they're having pain, we do that. There's some actually traction, it's called apophysitis there. We also feel actually at where the heel is gently without causing severe pain, and just to locate where the problem is. For Severs, it tends to be just behind where the heel bone is. At that point, that's where the growth plate is, and if it's inflamed, it causes some pain there. So then the other thing that we do also, we tell them to stand facing the wall. We look at them from behind, and if they try to tiptoe and they have pain at the back of the heel, so that actually confirms that it's the one. Then after that, we probably send them for x-rays just to assess if there's any obvious swelling or if there's any fracture, just to rule it out. And we send for both feet X-ray it's called lateral foot X-ray, just to see how that growth plate is lined up. Then once we do that, we now have a discussion with the child. Then we either give analgesics or painkillers initially, just for pain, and advice on rest and what actually I'd alluded to. Yes, so also in addition to that, first, if they're in that immediate phase where they're having pain, we first hold off the physio just to make sure and hold off activity. So once the pain has resolved a bit, they're able to tolerate, they now start the rehab protocol.
Oh, all right.
Yes.
So we'll continue with this conversation. It's revolving around Sever's disease that affects the bones, and especially for children between the ages of 8 and 14. You have any question revolving around this disease or any other bone condition that you need clarification on? You can simply text us on 20933 or WhatsApp on 071 400 555. And tonight, I'm hosting Dr. Philemon Nyambati from AICQ International to look at those questions regarding the health of your bones. We'll have the part 2 of this session in the next hour.
Breath of heaven. Today, we don't